Are you all hyped up with what UCD is doing and where we are going as a collective? I personally am thrilled that they are going to be becoming a nonprofit. My name is Roxanne. I am so honored to be here and to share with you things that I'm extremely passionate about. And UCD has been one of those elements that I have been very, very connected with. And when they mentioned that church way back when, Cliff, you remember some of those meetings in that church, and what a beautiful way to have started this collective. Throughout the years, we have seen that it really is that concept that if you want to go fast, you go alone. But if you want to go far, you have to go together. And today, together, I really want to walk us down this path. I am a psychotherapist by profession, and I am delighted to be able to walk a journey of healing with so many individuals that bless me with their stories. And one of the things about stories is that experience and generational experiences are usually embedded in these stories. Think about it. Each one of you is a story in and of yourselves. My name, like I said, is Roxanne. I lead an organization called the Healing Center. And what we focus on is really helping people to transform lives. And today, what I'm going to be speaking with you is something that I hope that it not only plants a seed in you, but that if you hear some of these concepts out there, that you can say, wait a minute, okay, how can I validate this? How can I normalize it? As a therapist, one of the things that we often hear is, pero yo no estoy loco. I'm not crazy, right? Something generational. And that concept, and I tell people, it's not that you're coming here because you're crazy. You're coming here because you don't want to be. You don't want to drive yourself nuts with these thoughts that we have. So in this aspect, today we're talking about susto. Have you all ever heard that word? Right? Tell me some of the words or phrases that you've heard around that word. Exactly. Me entró el diabetes porque me asusté. Or sometimes you approach somebody, they get so startled and they're like, ay, me asustaste, right? So there's a lot of truth that comes in here. Today I'm the myth buster when it comes to susto and type 2 diabetes, because my goal is for you to be able to see how these things actually correlate, and how when we have heard these concepts from maybe our parents, our grandparents, our great-grandparents, it was actually that there was some truth to this. So let's go ahead and take out those phones, handy dandy phones that everybody has, and I'd like for you to go ahead and just scan this QR code. And the concept is, what correlation does susto have with a sudden onset of type 2 diabetes? The beauty about this is that nobody knows who's typing it. It's completely anonymous. So just put your honest truths about what correlation, if any. If you believe there's no correlation at all, you can go ahead and put that as well. And let's see what everybody has to say. There's a slight correlation, something I've definitely heard before. No correlation at all. Okay, what else do y'all have to say? A lot of brave people typing. No correlation. It can be cured. Si te curan, that's interesting. Cortisol, fear spike, a cascade, something I've definitely heard before. Bodily reaction, perhaps. All right. Notice that there is so many people in the room where, and I love this because the more deeper connections or thoughts that you all are having constitute that there is no correlation, which I absolutely love. Cortisol, very high. Fight or flight, fear. It may be indirect, it increases. All right, so that is the consensus in the room. And honestly, likely if I would have asked this amongst the group, maybe some of us would have been fearful to actually say, like, I don't believe that there's a correlation between it. And this is where the psychotherapist in me comes in and provides that education as far as what this connection may be. So, a little bit about me, like I said, I am blessed to be a servant, a public servant in our community, and to be able to do these things that I absolutely love. I have been blessed as well to be a TEDx speaker and to share my story of grief and how it led me to where I am today. And the concept behind it is always wellness and helping to improve just the way that we show up in life. Moses talked about those Mondays. So many of us dread those Mondays, right? But like I tell my clients, the most important part of life is we all have a beginning date, a date of birth, and we all at some point, like he said earlier, there's a 100% chance that everybody in this room at some point will complete our own race. The most impactful part is the dash in between both of those. And that really is what I want to improve in the clients that I'm blessed to serve. So, what are the objectives for today? Of course, define Susto, describe how it looks, especially from a psychotherapeutic component, to summarize some of that research, to identify what is this cultural phenomenon behind it, to learn how to apply, especially if you're working directly with people. How many of y'all, by a raise of hands, work directly with people? Okay. Great. How many of you all are preparing yourselves to work directly with people? This line right here. This line right here out of the whole room, along with my own intern, Natalie, this is really things that oftentimes we're not going to learn about it in school. So be really, really grateful that you get to learn it ahead of time, and it helps you to build better connections with those that you're going to be working with later. And then just learning to integrate it collectively as a community. So susto, it's known as this fright, right? Me asustaste comes from a component of something happened that was completely out of our control that led to a physiological response in the body. And in that moment, it alters the chemistry of the body. And not only does it alter the chemistry of the body, but it alters first the chemistry in the brain. So it's often cited as a trigger for illness, including diabetes. Why do you think that is so? Just spit it out. Why would it be triggered as an illness for type 2 diabetes? What happens when susto takes place? Heart rate goes up. What else? But blood pressure goes up. What else?
I assume your pancreas would stop working and would go into shock.
Okay, very good. So there is an entire physiological response. And keep in mind, I'm introducing it to you through a trauma lens and a trauma component. Because what we know about trauma is that trauma is not what happened, although that is very, very important to your story. But trauma is not that traumatic experience. Trauma is the visceral response that the body has at the moment when that happens. Culturally, our ancestors, our parents, grandparents have referred to it as susto. However, the response is very much like acute trauma. Acute trauma meaning that it's an onset. It just happened. The heart rate started to beat so fast. There was freezing in the body. There was a fight, flight, freeze, or fawn response in the moment. And at that moment, we know that we are no longer in a still body, which is what promotes all of the healthy hormones in our brain. At that moment, we have become activated, and as a result, there is this bypass that takes place, and now our body is presenting with something different. And I call it acute because in that moment, there is so much opportunity to actually do something with it that is not going to lead to symptoms of PTSD, post-traumatic stress disorder, and hence causes new normal for the body, where it stays stuck in this fight and flight response. What does that look like? So for example, let's say that you're involved in an accident. Anybody here ever been in an accident? So initially what happens? There's this response. The accident is then left behind, but now your body is thinking that it's gonna happen again, right? It gets stuck in a response. So our ancestors were so wise with being able to put a label to try to help themselves to understand something. I'm gonna share with you something. I led a nonprofit for a long time that is so dear to my heart. And one of the things that I admired the most out of the clients is the fact that, one, they didn't want to be a charity case. Two, they had so much integrity. But three, when it came to medications, oftentimes they knew el tecito, la moringa. They knew culturally something that could help them. El oregano cubano would help them with anxiety. There was just so many medications that holistically, pharmacy, they knew what to integrate in order to help themselves in a holistic way. Susto is one of those components where people knew, but they were looking for somebody to validate that which they already perceived it. Here is our opportunity to bring some validity to the fact that maybe they knew a lot more than what we know right now about it. All right? Somebody stated in that Slido, as far as si te curan, right? That's a lot of folk healing. But believe me when I tell you that when you integrate ways that make sense to that person, when we as a society, as a professional society, validate something that to them is meaningful, and then we begin to integrate the evidence-based approaches to help them to gap this and to bridge this connection, they're gonna be so much more receptive to what you are now educating them with. As opposed to telling them, that's not valid. What do you think is going to happen with them at that point? Complete shutdown. And at that moment, we do no different than what has generationally already been done to them. We simply are the professionals that shut them down. So, does this make sense to you all? All right. So, have you all heard of Dr. Bessel van der Kolk? The body keeps a score, right? What does that mean? In you all's view, what does it mean for the body to keep the score?
Your body remembers like trauma that has happened to you in the past.
Exactly. The body remembers. The thing here is that the brain needs to process. But when the brain does not do its job at processing, the body becomes a mirror to what's not worked out in the brain. I was having a conversation earlier, and it's a little bit of a TMI, but just to help you to understand some of the concepts that I guide my clients through. So this young lady was telling me, you know, like, my intestines froze. I literally have been constipated for such a long time, and I don't know what the heck is going on with my body. The correlation here is that oftentimes any gastric issue, and that's usually where it starts, because cortisol, the adrenal glands release all of these chemicals right into the gut, and at that point, it slowly starts to keep score to the body. So in that aspect, the body is holding on to something that in your brain you haven't even acknowledged, it's holding on to it as well. Usually, the gastric system is going to be connected with unforgiveness or bitterness. So what happens is that your body cannot digest because it does not belong to the gastric system to digest this. It's something that has to be acknowledged at the root. For people, for example, that often have the runs, they have a mentality of, I don't care. I don't give a crap, right? That's what they say. It's the normal thing that we say. So what happens to the body? The body is constantly releasing, and that causes a different kind of problem. So here, I say this to you, one, so that you can see how balanced your own bodies are, because the gastric system is going to be the first warning sign that goes off in the body. But two, so that you can understand that there is a very, very distinct correlation between the body and the brain. What makes us wiser in our approach is when we're able to integrate both of them, and then we're able to help somebody through this. So, in this aspect, let me just share with you a little bit about a study that was done where chronic psychosocial stress, trauma, and PTSD demonstrated that there is an increase of type 2 diabetes of up to 2 times higher than in individuals without trauma exposure. The chronic activation of the HPA axis increases cortisol. Somebody said earlier, right? There's an increase of cortisol. What is cortisol known as? The stress hormone. So as a result of that, it promotes gluconeogenesis, visceral fat accumulation. Anybody you ever had a muffin top? Right? And you're doing all the things to get rid of this muffin top, and the more you do, the bigger your muffin. Right? And when we're eating it, it's great, but when it's not so great. So what's going on there? Oftentimes, this accumulation is simply because we're stuck in this response. The hypothalamus is stuck in a narrative that keeps letting the body know, produce more cortisol, produce more cortisol, produce more cortisol. It's literally stuck, like a button that gets hijacked, and no matter how much you're trying to release it, it's not doing anything. It gets stuck. So as a result, cortisol increases in the visceral area, and what do you think happens with that? So as a result of it, in Hispanic communities, culturally meaningful concept acknowledge improving the trust and the connection that we have with the people. And let me tell you that the best way to connect with people, you cannot have effective communication if there is no connection. The best way to connect with them is to let them be the expert in their own stories. Let them be the one that facilitates this information to you, and you knowing the backstory of what's happening in the body is going to help you to then meet them where they're at. Does that make sense? And for those research, if you're a researcher in the room, by all means, I will be more than happy to share at the end of the presentation. All of the references are included. So in addition to that, there's evidence that stresses the impact of multiple psychological symptoms. Here, the HPA axis dysregulation, and this you're going to see by the chronic cortisol elevation, which diminishes insulin receptor sensitivity. There was somebody on this side that mentioned, right, that there's a decrease or an inability. It's almost like the adrenal glands get frozen, right? They're not able to do what they normally know how to do in a regulated body. So as a result of this, it causes an inflammatory response to the body. Any of you all ever heard the term fibromyalgia? What does that mean? I'm curious. What is that? A constant pain, right? A lot of the elderly that I treat, and some of them not that elderly at all, trauma typically adds about 10 years to the way somebody looks. If you've ever seen somebody that they're 30 years old and you're like, man, they look like if they're about 50, that usually symbolizes trauma. Then there's other times when somebody's able to heal themselves and help themselves, and you look at them and you're like, how in the world can they be 80 years old? They look younger than me, right? The body keeps the score. So when it comes to this concept, at that point, it's so important for us to be able to understand what's going on in that point, right? So when we're looking at the behavioral pathways that are going on with this, the metabolic dysregulation that is taking place, and you're going to see it. With fibromyalgia, there's been a point where doctors don't even know. It's almost like we can't pinpoint. They go in for lab work, they go in for the MRIs, the CAT scans, the ultrasounds, you name it, and everything is, what's the word? Normal. And that person feels completely misunderstood. How can you be telling me that everything is okay? I don't feel okay. You touch them, and what my clients tell me is, it's almost like if I'm a glass and I'm literally breaking in the inside, and every neuron and every neuroreceptor is completely activated. That is inflammation to the body. Right? Inflammation to the body has been connected with a lot of autoimmune disorders, lupus, I mean, you name it. So many autoimmune disorders that people do not realize that it is because of inflammation to the body. And the reason why there's inflammation to the body is because, once again, during that acute period right after this incident where there was susto, where there was a fright, where there was trauma, it was not addressed. And that became now a chronic condition that this individual learns to normalize, and they learn to live with, almost as people that get diagnosed with type 2 diabetes, and the moment that they receive the diagnosis, what is their immediate thought oftentimes? I'm gonna die. It's a death sentence for them. Is that the truth that we know? No, right? Other people that say, well, it's because it runs in my family. And the thing here is that just because something may quote unquote run in your family does not mean that it has to be activated. This is where our work is so important, because our work goes back to helping them to gain the education so that way they can do something different. One of the ways that connects me the most with patients that come in with type 2 diabetes is I ask them, what's your age? Or what's your mother's age? Let's just say mother has already passed away from complications of diabetes. It's never the diabetes. Usually it's the complications of the diabetes. And they tell me, well, my grandmother was 70. And I remember learning that for every generation afterwards, it's like if life expectancy decreases by 10 years. So if your grandmother lived to be 70, that means that your generation is going to live to be about 60. That means that your children are going to learn to live about 50. Your grandchildren are now going to live to be about 40. And at that moment, they put a pause, because they may not believe in their own healing or opportunity for it or worth of it, but they sure do believe in it for their children and grandchildren. And if that is what you use to help them to have some buy-in into doing something with this trauma that happened, this thing that they've been holding on to. Now, this is a book that I love to share with my clients. The majority of them come from a faith background, especially in the nonprofit sector. I would say maybe about 95% of clients that came in there came with a belief in something higher than them. Why? Because they would tell me, es todo lo que tengo. It is all I have. And if that is all you have, then that is all you need, because it helps me to be able to make connections for you. This book has so much evidence behind it as far as that connection between, and it is through this book actually that I learned that physiologically, holding on to something from the past, holding on to pain, unforgiveness, you name it, was highly correlated to arthritis. And I started to think about that. And I started to think that so many times as time goes on, right? You've heard your abuelitas tell the story, pues es que me hicieron, es que en ese tiempo, and they're literally recounting the stories from back then. And they are literally holding on to the unforgiveness that they have lived with. And if you think about it, the more time passes, the more that those joints begin to literally show what they're holding on to. So, learning how. Another one that I learned along the way was there was a time about maybe 2 years ago when I just broke out in a flare of acne. And I thought to myself, not even when I was in high school did I go through this problem. So I went to my handy dandy book and I opened it up and it said, what's getting under your skin? It's almost like somebody threw a stone at me. And I thought to myself, you know what? I know what's getting under my skin. I addressed it up here and my body stopped doing the work. So this one is definitely one that is going to help you to work through a lot of those underlying issues to get to the root of what is actually at stake here. So how stress affects the body, right? Any of you all have been absent from stress? If you have, I'd love for you to mentor me. I believe that stress is something normal. It's a given in life. It's how we respond to that that is going to be different. So here, this is basically the information that I just shared with you. Now, I'd like to give, as a therapist, a special focus as far as the behavioral changes when it comes to Susto, right? The hypothalamus is responsible for certain behaviors in the body. Amongst them, food, energy, sleep. Now, I'm going to give you a typical story that I have heard not only in my own family, but that's usually stories that patients come in with. And what they tell me is, for example, I remember one client telling me that their son was out in the oil fields and he fell. He wasn't wearing a harness. He fell from a long distance. And what do you think that the client said that was now wrong with her son? Está asustado. So I asked her, what symptoms are you observing in him? No come, no quiere comer, ni quiere beber agua. He doesn't want to drink. He doesn't want to drink water. Food and intake are processed through the hypothalamus. She also said, se la pasa dormido. He spends his time asleep. These are all behavioral activation responses that are processed through the hypothalamus, who gets disrupted at the point when fright takes place. Does that make sense? So when we have this knowing of what the brain is doing and we hear the story, we can understand that they know a lot more about symptomatology than we do. They're actually making connections. They're bringing us these connections, and our job is to help them to understand, you know what you are saying, that's actually the way the brain works. And let me tell you, not only is that the way that the brain works, but that's the way that the brain responds when it feels that it needs to protect us from something. So that actually makes you extremely wise in the way that you're sharing this story with me. And now let me go ahead and provide you with the wisdom that I know about the way that the brain can then heal. Does that make sense to you all? So, from fright to the physiological component. The major scare triggers the hormones and inflammation. We've talked about some of these hormones, the cortisol, the HPA axis, what's going on in that realm. It raises blood sugar rapidly. It's almost like there's an adrenal response when it comes to it, and that adrenal response is necessary for survival. Have you all ever heard when there's an accident and somebody goes in there and they lift a vehicle, right? That's not a normal response for the body. But in that moment, that surge of energy and adrenaline is necessary for survival to take place. Guys, this is what the brain knows how to do. But as a result of it, what happens afterwards? A crash takes place, right? So it's extremely necessary to be able to then guide the body and the brain through this process. Now, when it comes to culturally sensitive care, as therapists, our goal is to do no harm and to meet the person where they are. I would encourage that you take that not only as a therapist, but in life. When somebody comes in, when you're across from that person, when you're taking that, what department are you guys with? Nursing? Okay. When they're in the process of sharing their story with you, believe them for what they're sharing. Take it seriously because they are the experts in their own lives. Validate. I cannot tell you how much validation will help to improve the connection. Do you know that 70% of the communication that we have is by body language alone? 70%. The moment that a patient starts to tell you their story and viscerally, through your own nonverbal communication, you disengage, you've already told that person, I'm not meeting you in that space. So look at them in the eye. Oftentimes we have a culture of people who have been oppressed and depressed, and they have been so used to being invisible and invalidated, so our opportunity to look people in the eyes is what's going to help them to connect with you. Screen for trauma and metabolic changes. That response, how's your food intake? How is your sleep? Are you more sensitive to pain than normal? How's your digestive system? You are using their own concepts and speaking back to them in a way that's going to make sense to them. And if you create that, they're going to trust you. Use trauma-informed therapy and stress reduction. There is a particular activity called tapping. Any of you all heard of tapping? Okay. There is a website called capacitar.org. It is an excellent resource of evidence-based practices that are used for mindfulness with trauma-related pain or experiences. This is a practice that I particularly use, especially with my clients that have gone through trauma or are presenting with hypertension. Hypertension means what? High blood pressure, exactly. And let me tell you that what I particularly like to do in session is if I notice that they're activated, I will check their blood pressure, and then I do the tapping, and afterwards we check the blood pressure again. And what the client is able to see is that through their own ability to manage their emotions, through the regulation of their body, they were able to decrease that blood pressure significantly without additional use of medication. I am not saying for them to discontinue medication, not at all. However, they have the capacity to bring that and neutralize it and regulate themselves so that their body and their brain can release that continuous mode of self-preservation, and as a result, they can begin to now be still. Stillness is in the frontal cortex, prefrontal cortex. Amygdala has us in constant fight, flight, freeze, or fawn mode. Two very, very different components. Susto lives in the amygdala. A client that is living through Susto cannot calm down. They don't know how to do that. So those are the strategies that I encourage. And above all, knowing how to be present, knowing how to connect, knowing what information to provide them, all of that is great. But I started this with saying, if you want to go fast, you go alone. But if you want to go far, we have to go together. There are medical components that I could not stand here and say, I understand. So therefore, I need to go and connect to a provider that's going to help my client to understand what's going on with their bodies. That's going to help them to read that lab work. I need to be able to connect with somebody else in my community who does the mindfulness, who does other things that are going to help my client. To connect with an organization, and it's all about connection. Our value is based on our network. And the more connection you have to other healers, other people that are in a collective impact, such as UCD, the greater power we have to actually make a difference and get to that 10% by 2030. So, takeaways. Susto is both cultural and physiological. Respecting beliefs, that builds trust. And integrating science with cultural humility improves our outcomes. None of it is possible without the data, because at the end of the day, and I have Cliff here who is, in my opinion, somebody that I dearly respect as far as data is concerned. The data helps us to put the story together. If you have capacity to track for your clients, for your patients, do so, because UCD needs that information. I thank you for the time and the space that you have granted me this morning to talk about this phenomenon. I encourage that you reach out to me. Please, if there's any way that I can add value to you, that I can be present with you, know that my heart is in it for the same reason that yours is, to see people, to hear people, and to help people to know that they are worthy of being understood. My name is Roxanne, and I am here to serve you. Thank you so much.